Artificial Intelligence Dr. www.abcpharma.net/English. User question: what role do inflammatory markers and adipokines play in the development and progression of prediabetes? And how can these biomarkers be used to predict and monitor the risk of progression to type 2 diabetes? GPT-4o answer. Inflammatory markers and adipokines play a significant role in the development and progression of prediabetes, serving as both contributors to and indicators of metabolic dysregulation. Here's an in-depth look at their roles and how they can be used to predict and monitor the risk of progression to type 2 diabetes. Role of inflammatory markers and adipokines. Inflammatory markers. C-reactive protein, CRP. 1. Interleukin-6, IL-6. 2. Tumor necrosis factor alpha, TNF-alpha. 3. Role. CRP is a marker of systemic inflammation. 1. Elevated CRP levels are associated with insulin resistance and beta cell dysfunction, which are key features of prediabetes. 2. Mechanism. Chronic low-grade inflammation can impair insulin signaling pathways, leading to decreased glucose uptake by cells and increased blood glucose levels. 3. Role. Illinois-6 is an inflammatory cytokine produced by adipose tissue, liver, and immune cells. 3. Elevated IL-6 levels are linked to insulin resistance and chronic inflammation. 4. Mechanism. IL-6 can interfere with insulin receptor signaling and promote hepatic glucose production, exacerbating hyperglycemia. 5. Role. TNF-alpha is another pro-inflammatory cytokine that contributes to insulin resistance. 5. High levels of TNF-alpha are often found in individuals with obesity and prediabetes. 6. Mechanism. TNF-alpha impairs insulin signaling by promoting serine phosphorylation of insulin receptor substrate 1, IRS1, leading to reduced glucose uptake. Adipokines. 1. Adiponectin. 2. Leptin. 1. Role. Adiponectin is an anti-inflammatory adipokine that enhances insulin sensitivity. 1. Lower levels of adiponectin are commonly observed in individuals with prediabetes and type 2 diabetes. 2. Mechanism. Adiponectin improves insulin sensitivity by activating AMP-activated protein kinase, AMPK, and enhancing glucose uptake in muscles and liver. 3. Role. Leptin is an adipokine involved in regulating appetite and energy balance. 3. Elevated leptin levels, often seen in obesity, are associated with leptin resistance and insulin resistance. 4. Mechanism. High leptin levels can lead to chronic inflammation and impair insulin signaling, contributing to the development of prediabetes. Predicting and monitoring the risk of progression to type 2 diabetes. 1. Biomarker measurement. 2. Integrating biomarkers with clinical data. 3. Monitoring treatment efficacy. 4. Early intervention and prevention. 5. Research and personalized medicine. 1. Routine testing. Regular measurement of inflammatory markers, CRP, Illinois-6, TNF-alpha, and adipokines, adiponectin, leptin, can help identify individuals at higher risk of progressing from prediabetes to type 2 diabetes. 2. Risk stratification. Elevated levels of CRP, Illinois-6, and TNF-alpha, along with low adiponectin and high leptin levels, can stratify patients into higher risk categories, prompting closer monitoring and earlier intervention. 3. Comprehensive assessment. Combining biomarker data with other clinical indicators, e.g., fasting glucose, HbA1c, BMI, provides a more comprehensive assessment of diabetes risk. 4. Predictive models. Developing predictive models that incorporate both biomarkers and clinical data can enhance the accuracy of risk prediction for type 2 diabetes. 5. Tracking changes. Monitoring changes in inflammatory markers and adipokines in response to lifestyle interventions, e.g., diet, exercise, or pharmacotherapy can help evaluate the effectiveness of these treatments. 6. Adjusting interventions. Adjustments to treatment plans can be made based on biomarker responses, optimizing individual patient care. 7. Targeted interventions. Identifying individuals with elevated inflammatory markers and adverse adipokine profiles allows for targeted interventions aimed at reducing inflammation and improving insulin sensitivity. 8. Lifestyle modifications. Interventions such as weight loss, increased physical activity, and dietary changes can reduce inflammatory markers and improve adipokine levels, thereby lowering the risk of progression to type 2 diabetes. 9. Biomarker discovery. Ongoing research into new biomarkers of inflammation and adipokine function may uncover additional targets for predicting and preventing diabetes. 10. Personalized approaches. Personalized medicine approaches that tailor interventions based on individual biomarker profiles can enhance the effectiveness of prevention strategies for prediabetes. Conclusion. Inflammatory markers, CRP, Illinois 6, TNF-alpha, and adipokines, adiponectin, leptin, play crucial roles in the development and progression of prediabetes by affecting insulin sensitivity and promoting chronic inflammation. Measuring and monitoring these biomarkers can improve the prediction and management of the risk of progression to type 2 diabetes. Integrating biomarker data with clinical indicators allows for early detection, targeted interventions, and personalized treatment strategies, ultimately enhancing patient outcomes.